Biomechanics and its underlying principles is a fundamental aspect of every sport, particularly when analysing technique, efficiency, and movement patterns. Biomechanics is the understanding of internal and external forces acting upon the human body and the outcome of these forces. Kinematics and kinetics are both subcategories of biomechanics. Kinetics explaining the movement of the body without respect to what causes such movement, and kinetics being the study of movement and its causes. In this presentation, the primary focus will be the kinetics subcategory of biomechanics. The movement pattern to be analysed is the freestyle swimming stroke, specifically the flutter kick, the pull, and the recovery phases. As a part of this presentation, the biomechanics principles which underpin the freestyle stroke will be discussed in depth, with an analysis of a 16-year-old male student's performance used to enhance this. The student at hand is considered to be rather athletic, and have managed to qualify for the school swim team with little to no training. The student is now expected to attend and compete at the Inter-School Swimming Carnival in 4 weeks' time, and would like to improve his performance. With the framework of biomechanics principles acting as a guide, a series of constraints-legged activities can be designed to aid the student forward towards his goal of improvement in the Inter-School Carnival. The first phase of the freestyle stroke to be analysed and critiqued is the pull. This is to be followed by the recovery and finally the flutter kick.
The pull phase of the freestyle stroke starts when the fingertips are placed into the water. The aim of this part of the stroke is to pull the body over the hand rather than the hand travelling through the water. As you can see in this video, the full phase of the pull stroke, the swimmer is reaching right out in front with the aim of pulling herself over the top of her body. This will be the focus of our athlete. So now we're going to go into more detail. The entire pull phase of freestyle can be broken down into 4 smaller phases. The glide phase, which can be defined as when the hand enters the water to the beginning of its backward movement. The second phase, known as the down sweep, starts at the end of the glide phase to the most lateral position of the hand in the transverse axis. After this begins the in sweep, which starts at the end of the down sweep and finishes at the most medial position of the hand in the same axis. The final phase within the pull phase itself is known as the push phase, which begins at the end of the in sweep all the way through until the hand exits the water. These 4 phases must all work sequentially and affect how each one operates. If the glide phase is too small and the hand is in the incorrect position, this will affect the down sweep. If the incorrect movement pattern is used for the down sweep, the in sweep will be insufficient, and so on. Now that we know the laws involved, we can discuss further the direction in which the forces are being applied. These forces are being applied in a linear motion. So as we mentioned previously, the greater the applied force in a linear motion, the greater the increase in velocity. This becomes most important when the swimmer applies more pressure on the glide phase and the push phase. The movement also occurs in the direction opposite to the applied force. The following diagram represents the hand position for the full phase of the stroke to assist with this linear motion. We can see that the resultant force applied occurs through the linear motion and gives the swimmer necessary lift and forward motion. Siedelnick and Young stated that having the fingers together or spread to approximately 10 degrees apart and in a slightly cupped position will give the swimmer maximum forces. So we know about the laws of motion, but what about the levers that are making all of this happen? There are 2 levers that have been identified. The first class lever occurs when the arms are at opposite ends of the body. One arm is performing the glide phase while the other is in the finishing the stroke. A third class lever is also identified, where the elbow bends and the down sweep phase begins. So now that we know more about the science behind linear motion, levers and forces, let's identify the key problem areas for our swimmer. These 3 videos will give us a good insight into how we can get our swimmer to a greater velocity through the water. As you can see in the first video, the fingers are spread too far apart, which reduces the force being applied and not being pulled forcefully through the water. This can be seen more clearly in the second video. In the third video, you can identify the pattern of the arm movement that is inefficient and can make the swimmer tired very quickly. So the overall aim of this constraint is to increase the velocity of the swimmer. To do so, we must understand the relationship between the stroke rate and the length of each stroke. As you can see in the top left graph, there is a direct relationship between stroke rate and velocity. With this comes the length of each stroke. Swimmers need to recognize the relationship and how swim distance can affect these three variables. Swimmers need to find their individual stroke rate and how it affects the length of each stroke to increase their velocity. Initially, we will focus on the stroke length and pulling through the water. This will be discussed in further detail later. This picture shows the type of movement we can see in all three planes in order to increase the velocity. You can clearly see the line the arm follows. The arm makes a movement underneath the body, which was not being seen in our athlete's video. We want to see the arm in this position during the in-sweep phase. The reason we want to see a bent arm over a straight arm is because having a bent arm increases torque values around the shoulder joint, but still able to generate maximum linear force. We have also identified the type of position we want the hand in during the pull phase. And now that we know all this, we can implement a constraint to improve our athlete's swimming velocity. As mentioned previously, the aim of the constraint will be to improve stroke length. By doing this, we have asked our athlete to swim 15 metres down the pool and count the number of strokes it takes to get there. Once we know this number, he will aim to reach the same distance in less strokes by increasing the speed of the pull phase and increasing the stroke length. As you can see in the video, the swimmer notes how many strokes it takes to reach the same distance, and a clear difference can be identified in the length of the stroke. This constraint has required the swimmer to focus on the pull phase of the stroke to increase velocity, as well as the movement pattern that has been described earlier. You will see how the swimmer adjusts their technique in order for this to happen. The next step is to perform this under fatigue. Once we see this constraint decaying, there needs to be a change. We go back to the table that shows how stroke length and velocity is affected under fatigue. We ask the swimmer to perform the exercise under a fatigue condition, as this becomes very important later in a race. Once this has been completed, the swimmer will be able to increase stroke rate whilst keeping a good stroke length. Ultimately, this will lead to increased velocity through the water.
Although considered to be merely the rest phase amongst swimming novices, the recovery phase of the freestyle stroke is comprised of numerous complex biomechanical principles. In order to effectively master the stroke, acknowledgement of these principles as well as repeated practice of encouraged movement patterns is required. With hopes of highlighting key subcomponents of the recovery phase, an in-depth look into the biomechanics of the freestyle stroke will be provided. In addition, an analysis of an individual's performance will be used to justify the implementation of a constraint aimed at manipulating their personal learning experience. To conclude, an appraisal of the constraint's effectiveness as a learning tool in the individual's endeavours in achieving their own personal goals will also be provided. All movements that occur throughout the human body can be described in terms of planes and axes of motion. Within the recovery phase of the freestyle stroke, action occurs within the transverse and sagittal planes, with movements taking place along the anterior-posterior and longitudinal axes. At the conclusion of the pull-through, when the swimmer's arm is leaving the water and entering the recovery phase, the shoulder is flexed, posterior to the body, moving within the sagittal plane. Concurrently with the flexion of the elbow, which allows for easy rotation of the shoulder joint, a retraction of the scapula should occur. For the swimmer, this should feel as though they are pulling their shoulder blades towards each other. From this point, the protraction of the scapula should extend the arm superior to the body, causing the individual to rotate the torso through the longitudinal axes. This summation of movements is what allows the swimmer to then prepare for the catch phase of the underwater pull. The coordination of key body segments in swimming is of particular interest for swimmers and coaches. However, before this can occur, a level of stability must be achieved. During the recovery phase of the freestyle stroke in particular, the transverse abdominis, rectus abdominis, as well as internal and external obliques are all key in achieving this core stability. A fundamental yet often overlooked aspect of the freestyle stroke is the rotation of the shoulders, torso, and hips. So crucial is this element of the stroke, as it aids in establishing an easier recovery position, which in turn leads to injury prevention. It engages larger muscle groups that can be used to generate power, and it enables the body to manoeuvre itself in such a way to increase stroke length. With intent to explore these aspects of the freestyle stroke, an analysis of the individual's performance can be provided. As can be seen in the evidence video, the individual is seen demonstrating a competent freestyle stroke. What is first noticed is the utilisation of a straight arm recovery position, as opposed to the more traditional flexed elbow. As the individual's arm exits the water from the pull phase, a posterior abduction of the shoulder joint creates an extremely wide recovery. Such a straight arm recovery is signature of champion freestyle sprinters Michael Klim and Nathan Adrian. The sheer muscle behind these athletes allows them to throw so much power into each stroke that this technique has become most efficient for them individually. In general terms, however, a straight arm recovery demands a much higher energy expenditure and as such is not ideal for beginner to intermediate swimmers. In addition, the further the swimmer's arm extends away from the body's centre of gravity and the higher the hand reaches out of the water, the lower the resultant body position. This is the result of Newton's third law. For every action, there is an equal and opposite reaction. The swimmer's ultimate goal is to get from one end of the pool to the other in the fastest, most efficient way possible. As such, an ideal body position should always be maintained. As was previously mentioned, the rotation of the shoulders, torso, and hips is crucial. However, over-rotation can lead to a variety of issues, namely injury. Due to the individual's lack of swimming experience, in order to summate enough force to complete the full posterior abduction rotated around the shoulder joint, a slight over-rotation is being used. This could lead to the athlete adopting a rather dangerous habitual technique if an intervention is not staged in a timely manner. Before working with a coach or teacher to improve on their current technique, is it imperative that the individual has the opportunity to map out their goals and work out specifically what they are wanting to achieve. The SMART criteria for goal setting can be used for this, mapping out goals that are specific, measurable, achievable, realistic, and time-bound. The individual in question has recently been named on the school swim team to compete at the Inter-School Carnival in 4 weeks' time. There, he would like to place within the top 3. In order to do this, the swimmer has identified that he would like to improve the back end of his race, where he usually fades in the last 15 metres. This can be measured in time. The race he swam to make the team is recorded, so comparing the times from 1 week to another is entirely possible. Within the 4-week time period, improving on his backhand speed is most certainly achievable and realistic, whilst also including a time for which he expects to achieve this goal. With a significant drawback to their current technique, the exampled individual would benefit greatly from some outside assistance. After analysing the swimmer's current straight arm freestyle recovery, a task constraint has been identified that may help to encourage a more traditional bent arm. For the first lap that the individual is to swim, they are instructed that they must drag their knuckles through the water throughout the duration of the recovery. This simple direction automatically leads to a bent arm recovery, simply through creating a more proximal hand path. After close assessment, it was immediately evident that improvement had been made. This dragging the knuckles through the water, however, did create much higher levels of drag, resulting in a greater exertion of energy for the swimmer. To make a small modification, the swimmer was this time instructed to drag the very tips of their fingertips over the top of the water. This change was small but crucial. With the slight raising of the hand, there was a significant reduction in water resistance and drag, as evidenced by the lack of white water surrounding them. With this new and improved bent arm technique, the individual is able to improve efficiency through the recovery phase of the freestyle stroke. With this, they are able to improve on their backhand speed and thus achieve a faster time to work towards placing at the inter-school competition.
When analysing a movement pattern, it is essential to understand the biomechanical principles that frame this pattern. There are many vital components that make up the biomechanics of the flutter kick, which is most commonly used in freestyle. The underpinning biomechanics of the flutter kick includes plantar flexion, extension, the summation of forces, third-class levers, torque, and drag. Ideally, the action of the lower limbs is to be performed outstretched, externally rotated, and with plantar flexed feet. These are essential qualities of an effective flutter kick, as correctly flexed feet can equate for up to a 29.3% increase in the flutter kick speed, and effectively used legs can create a higher velocity with less energy expenditure. Correctly incorporating the legs means beginning with the hip and quadriceps, before moving to the knee and gastrocnemius, then finally the ankle and interior tibial. The continuous movement of these muscle groups and joints creates a summation of forces, yet again increasing velocity. Levers are made up of three components: the axis of rotation, the motive force, and the resistive force. Axis rotation being the joint, motive force being the muscle, and the resistive force being the water. In the flutter kick, the motive force is the quadriceps, the fulcrum is the hip joint, and the resistive forces is the water moved by the limb. When analysing the student's flutter kick, it has become apparent that their legs are sitting very low in the water. This causes more drag as they are not streamlined, thus decreasing their velocity. This can be caused by the fact they are kicking from their knees instead of their hips, as can be seen in the video. This presents two problems. One, they are creating more drag, making it even harder for them to move through the water. Two, they are not utilising their biggest muscle and lever in their legs, this being the quadriceps and the hip flexors. As stated earlier, the lower limbs are meant to be outstretched, which is currently not occurring. The location of the motive force has shifted to the gastrocnemius, and the axis of rotation is now the knee. This means the student is not utilising their legs to their full potential. They are cancelling out a major muscle group in their body, meaning they are exerting more energy to travel at the same velocity. The constraint used and analysed will try and rectify this behaviour. Before the constraint was implemented, strategies and goals were devised with the student. When planning the goals, we followed the goal-setting process of CARS: challenging, attainable, realistic, and specific. The overall goal was to improve the efficacy and velocity of the flutter kick to allow the student to place at the swimming competition. This goal was split into three subcategories to give a more in-depth outline. The process goal was to kick from the hips, the performance goal was to increase the velocity and efficacy of the kick, and the outcome goal was to place at the inter-school swimming carnival. The student's behaviour is being changed for an inter-school swimming carnival. The student did well in the school trials as they are a naturally fit, muscular and athletic boy. Their sheer muscle mass is what made them succeed. By altering their technique so they are kicking from the hip, it is being hypothesized that this will create less drag in the water as they will be sitting higher, and they will also be more efficient as they are utilizing all of their levers. An organismic constraint has been implemented, this being the student has to wear knee pads, except backwards. By doing this, the movement of the knee will be restricted, hopefully causing the student to self-organize and begin kicking from the hips. As can be seen in the video, the implementation of the knee pads was effective to an extent. The knee is not as bent as before, and the body is sitting high in the water. Having the body more streamlined automatically creates less drag. This means the efficacy of the stroke has already been increased. The knee is still quite bent though and is far from optimal. The body could also be sitting high in the water to create even less drag. The knee pad was potentially a good starting point for the student to slightly feel the difference without a major change, but the constraint put in place definitely needs to be improved and built upon. The student never reached a state of degeneracy. To build upon this constraint and allow the student to be more efficient swimmer, another task activity would be put in place. This would be a vertical flutter kick. By doing it against a wall, it gives the student a reason not to use their knees, as hitting the wall would cause pain.
To keep their head and arms above the water without touching the wall, the student will have to kick from their hips and have a strong plantar flexion. Depending on the ability of the student after trialling the activity, fins can be used or taken away. By doing this, the student will be forced to self-organize and kick from their hips. As the student begins to enter a state of degeneracy, they can be moved to the middle of the pool so they aren't guarded by the wall. Eventually, they can move from a vertical position to a horizontal and incorporate their stroke. This task has not yet been implemented but will be in the next session. The task yet to be implemented has room to progress, so this hopefully should reach the desired outcome.
As with all sports, the foundations of swimming lie in the biomechanics principles which underpin key movement patterns. Throughout the course of this presentation, the biomechanics principles governing the pull, recovery, and flutter kick phases of the freestyle technique were analysed and discussed in depth. A 16-year-old student's freestyle performance was also assessed with a series of drills and activities designed with the aim of further developing his skill. With the implementation of these constraints in mind, the student is a likely success to achieve his goal of improving at the Interschool Swimming Carnival and working towards owning a top 3 placing.